everybody. Welcome to ABA Inside Tracks bonus episode. As we've done for the past 2 years, with no exception, we are doing another BABAT special. Yes, all of us here at ABA Inside Track are huge fans of the BABAT conference held usually at UMass Amherst, though unfortunately and fortunately, this is going to be the last year that the conference is held at UMass Amherst in picturesque Western Massachusetts. From now on, we're all going to be meeting in Worcester, Massachusetts, which is great for us in terms of travel because it's not that far away. But anyway, that's beside the point. We decided to do what we did last year, which was take some time after all of the talks and the speakers to meet with some of the students exhibiting posters at the BABAT poster session. And many of them were very gracious to take some time to talk with us. We didn't have a chance to talk to everybody, certainly, but there was lots and lots of really cool research out there. But we wanted to share the audio from those who were able to talk with us for a little bit. And then we have a little treat. We think it'll be a treat. It was a treat for us, recording some of our colleagues and us hanging out and sort of reminiscing about what it's been like to be here at BABAT and some of the things that we saw at the conference and some of our favorite conference memories. But let's get started with our poster sessions, shall we? Our first student poster was from NICOLE LENARES, who together with Dracobly, Shea, Williams, Winship, and Spencer from Eastern Connecticut State University put together a poster on a descriptive assessment of activity-based variation in preschool children.
Hi, I'm talking to NICOLE LENARES about her work on a descriptive assessment of activity-based variation with preschoolers. So, NICOLE, thanks for talking with us. Can you tell us a little bit about your work?
So what we did was we went into a preschool with typical children or non-identified children, and we measured for 5 sessions for 7 to 10 minutes each session how many different items they interacted with and how many times they repeated interacting with the same item, just to try and get a measure of variability. This measure of variability can eventually be used to come up with a norm for variability and creativity in typical children, so that when we write interventions for non-typical children, those with autism or developmental disabilities, we know where to set our goals and what's reasonable so that we stay within the level of social significance and social relevance.
And that hadn't been done before? It sounds like something that there must be some measure of that. I'm so surprised.
There's actually very limited research out there discussing creativity and variability, especially in typical children, to get that norm. There has been research done with non-typical individuals and what their levels of creativity and variability are, especially coming from autism, because we know that they have very restrictive, repetitive behaviors as long as fixated interests, so that's really out there. But as far as typical children, it's not measured, which is really important because it's a prerequisite skill for so many different things in life as you get older, for problem solving or jobs or things like that. It's very important.
Oh, wow. Okay, so this was a definite need. I mean, I have parents, parents ask all the time, like, what should I expect? And you sort of have the general answers, but you actually went in and looked specifically at that level of variability.
Yep, and so this is just a preliminary study. It's going to be continuing down in Texas at University of North Texas.
Okay.
So we're going to hope to expand on that and get a wider range of participants and be able to really come up with a window for that norm.
What did you find so far, at least? Like, what were the take-home points you got from the work?
Well, some of the really interesting things that we found were it depended on what type of station the children were at, because it was done during free time, so they were able to pick and choose where they wanted to play.
Okay, it was like center-based preschool.
Yeah, it was
like,
center-based.
These are the ones we set up. We set up the art table, the block table kind of thing.
Exactly. There's usually about like 5 to 6 stations available, and 3 kids were allowed per station.
Okay.
So within reason, they did get to select where they wanted to play. We found that there's no relationship at all between the number of centers they visited in that window and novel or repeat item interactions.
Okay.
There was a slight negative correlation between novel item interactions and repeat item interactions.
Okay.
But some of the most interesting things that we found was the variation even within the student and then between these students. And a lot of that came from the centers they chose. For example, the iPad station yielded about 180 repeat item interactions, as the only thing available was the one app on the iPad. But stations like Dress Up or Kitchen or Blocks, that yielded way more novel item interactions just because that's what was available to the children.
Okay, Excellent. So, and you guys are currently working on continuing to extend this research.
Yes. Yep.
Very good. So, I mean, do you have any thoughts or any kind of hypothesis, or you're just going to see where the results take you?
I think a lot of this study is really about seeing where the results take us, especially with the lack of prior research. I do expect there to be somewhat of a wide window of variability that's still all appropriate within the social norms.
Excellent. Well, Nicole, thank you so very much for your time. Appreciate
Thank you very much.
Our next guest was KENDRA GUINNESS, who with Kevin Schlichenmeyer from the Autism Community Therapist Company put together research on a parametric analysis of intertrial intervals on establishing functional communication.
So we're here at the BABAT social, no, not the BABAT social, the BABAT poster session, talking to KENDRA GUINNESS about her research, her poster. So Kendra, what did you do for a poster here? Tell me all about it.
Sure. So we were working with a 6-year-old male diagnosed with autism spectrum disorder. We were conducting functional communication training, and after over 60 sessions under a traditional functional communication training arrangement, meaning a 30-second reinforcer interval, our participants still had not acquired the functional communication response. So yeah, that was
That's
kind
not
of
good.
troubling, yes. So we kind of were trying to conceptualize it, put our analytic hats on, and we suspected that it might be a maintenance issue. So we formulated a parametric analysis of intertrial intervals during functional communication training. So the way the arrangement worked is during our baseline, we just continued our traditional functional communication training arrangement where we provided a initial prompt during the first trial of the session, and then only provided error correction for the remainder of the session. And during baseline, the participants' level of independence was very low. Next, we shortened the intertrial interval to 2 seconds. So we presented the EO, the individual would mand, we would provide the reinforcer for just 2 seconds, and then start the next trial. And with that arrangement, we saw a really steep increase in acquisition. And then we gradually faded the intertrial interval until we got him back to that 30-second interval. We also conducted probes throughout this analysis that were identical to our baseline conditions, and we interestingly also saw increases in the probes across the session. So once the analysis was complete, we had our participant responding independently at the traditional 30-second intertrial interval.
Okay, so is this something that you feel is going to be, taught you more about the FCT process, or it was just very, very specific to this kind of idiosyncratic
I think
case?
It more just taught me more about how when a clinical problem comes up, kind of putting on that analytic hat and how we can use analysis as a problem-solving tool.
Yeah, excellent. Well, Kendra, thank you so much for talking with us and testing you're our first participant tonight.
Very
so thanks for testing my new audio toy here.
Thank you so much.
Coming up, we talked to Tay Humbert, who with Deco, Semino, and Kuhn from Milestones Behavioral Services did work on extending functional analysis session length to yield meaningful outcomes.
Now we're on. All right. I'm here with Tay Humbert and looking at her poster on extending functional analysis session length. So, Tay, tell me about your poster.
Okay, so typically we would run functional analyses for maybe up to 10 minutes each session, and altogether maybe about an hour of data. So with this particular client, it was a lot of carryover effects or seemingly carryover effects where either before session he's already kind of having a tantrum, or right after session starts from 1 but not during the actual session. So we decided, since during that functionalities we got very low rates, it was at 0. So we thought, okay, maybe we should try to account for these carryover effects and maybe extend the functionalities time. And not only time in 1 day, but actually extending it for 3 days straight. So each condition was ran so the toy play condition would be ran for 3 days, all day long, with the exclusion of lunch and snack time.
So when you say extending, you're extending.
So the moment he walks into school, he had a quick snack for maybe 5 minutes, 10 minutes, and then he was right into the functional analyses until lunch, and then until he went home. So when we went over for like toy, let's say the play condition, we gave him attention every 30 seconds. With also every minute we'll give him physical attention. And the demand, if he had any problem behavior during the demands, he would get a minute escape, and we'll just say, you know what, you don't have to do it. And then in attention, he would get 60 seconds of plain attention, not the same as toy play. It will look different, where instead of saying, oh, cool iPad, it's more like, oh, you have an iPad, just to get that acknowledgement. And then we moved on to the ignore condition. And in the ignore condition, he would not be ignored throughout the whole day because it was just, he was only 9. He was only 9, and we're like, we can't just like ignore this poor kid like all day long. So with that, we still gave him some sort of attention, and he would, if he came up to us, we would just be like, oh hey, just kind of plain and subtle. And then we also divided that time into every hour. We would still put him into a room by himself where there was no one around.
Okay.
So that would be the background. So as we also, with that, did a descriptive analysis. And the descriptive analyses was more, we will now try to pinpoint these antecedents that is evoking the problem behavior. So with that, we found a lot of different things, because in our original FA, we got nothing. He actually had higher levels in the toy play, and all the other ones were low. And we're like, what?
I've been in that bubble before. It's the worst feeling.
You're like, you love the iPad. Why are you upset? So that was the call for, okay, we need to also, while we're watching him all day, let's try to find these antecedents. So with the antecedents, we found loud noise, denied social attention, and then it was just no clear antecedent. So when you look at the graph for the full day FA, the ignore condition is lower than the play condition. So it kind of almost goes against the denied social attention that came up in the descriptive analyses. Because it's like, well, when we're ignoring you, you're not having problem behavior. But then for some reason, you're still having problem behavior when we're ignoring you.
Oh, jeez, that is complex.
It was very complex, and that was the reason why we had to do it for that long, that long of a time. And doing it for that long of a time kind of pulled out that there is automatic function. And then the results of that, of the full day, was it's not demands per se, because in our regular functional analyses it was at 0. It's the complex demands, and not only new complex demands, but those complex demands that involve fine motor. So we also did a parametric and a component analysis, which is in the other poster, but that pulled out that it's complex demands, specifically fine motor using 2 hands. But that's the conclusion of this poster, is we did find a function of complex demands and another function of automatic function. And then we're also targeting the loud noises on the separate analyses to see that outcome, and that's pretty much it.
Was this the longest FA you've ever run in your life?
It gets longer because he actually just got on a new medication that's supposed to suppress a lot of the stimulus, or they think that it's just something that he wants to do for positive reinforcement, which we haven't yet did an analysis on what type of automatic function. Is it positive? Is it negative? And such.
Okay.
So because of that, we are actually now redoing a reversal on the medicine, and then back to this again.
So so you're doing all of this.
It's pretty long.
You haven't even gotten to the treatment part yet. So there's still work to be done.
But we got some pretty good results. From this versus the zeros in the original FA.
Yeah, that is a frustrating feeling. So I'm glad that at the end you at least have a sense of where you're going to get to go.
We have a direction
for this fellow. Oh my goodness.
We have a direction. And that's.
Well, at least you got 2 posters out of it too.
We did.
So much work. I'm glad you were able to do that. Well, Tay, thank you so very much. And our listeners are not able to see, but I love your bow tie. I love it. I almost wore one myself today, but I only have like 2. So it's excellent. All right. Well, thank you so much for your time.
Thank you for having me. Thank you and everyone else who's listening.
Next up, Christina Hardy, who worked with Carter and Arcanian from Melmark, New England, to do their poster on an evaluation of systematically fading protective equipment to decrease problem behavior and increase academic skills.
This is Christina Hardy doing research on fading protective equipment, which I'm very interested in hearing. So tell me about your research.
Okay.
So I have a student who engages in high rates of self-injury and aggression, primarily self-injury in the form of hitting his head. As a result of this, he was hospitalized. When he came back from the hospital, they had put him in these protective mitts called posies, which basically inhibited his ability to use his hands.
Okay, they look like kind of puffbally boxing mitts? Is that kind of
yeah,
from the
there's
picture?
a lot of like padding.
Okay.
When he was discharged from the hospital, they used them at the home and for transportation to the school, but we weren't able to use them in the school just because they're too restrictive.
Okay.
So during our baseline session, we removed the posies upon arrival to school and didn't give any form of replacement. So we saw an increase in self-injury and aggression.
That's a big increase. You're talking, 450 up to 800, and it's a day or a session?
Yep, in a day. Okay. So 5-hour school day. Then we also noticed that he wasn't completing any work because we basically were just dealing with blocking and redirecting the self-injury and aggression. So we tried a lot of different antecedent interventions, a DRO, a DRA, which were not effective on their own. We might see a decrease in self-injury, but then we would see a spike in aggression. So we tried to do a replacement. So instead, when he would arrive to school, we would take off the posies and put mittens on. And he tolerated the mittens. So he would wear those for the day and then was able to complete some IEP work. And we saw a decrease in aggression and self-injury. So our criteria to advance was less than 100 instances of self-injury and less than 25 aggressions within the day in 4 out of 5 sessions. So from the mittens, we went to a mitten with a flap, and we kept that closed, but it was just to get him used to having his fingers in gloves and not in a ball.
But he could still take the flap off, but that was blocked.
He could take it off, but he did not attempt to.
Oh, okay.
From there, we went to the mitten with the finger flap open, so now his fingertips are exposed. Okay. And then from there, we switched to fingerless gloves, so pretty much all of his fingers were exposed. When we did that, we saw a big increase in self-injury and aggression then, and we did have in place to move back if he had more than 50 aggressions in a 30-minute span. Self-injury in a 30-minute span, just because of the significant damage he could cause.
Sure.
So we went back to the mittens with the finger flap, and then we reintroduced the fingerless gloves, and we've slowly, from fading it, been able to decrease his self-injury and aggression to almost 0 rates.
Wow.
And we increased his IEP completion. So we had a decrease in self-injury by 97% from baseline to the last session, and a decrease in aggression by 86%, and increased academic IEP completion at 97%.
So had you run, or had there previously been an FA on the self-injurious behavior or on the aggression?
Yes, so a FA was done, and it was concluded that it's primarily automatic.
Oh, okay. So. Yeah. For both the aggression and the self-injurious behavior, or just the self-injurious?
For both, there's a hypothesis that there is an attention piece to it, but primarily it's automatic.
Okay. Well, thank you so much, Christina. I appreciate your time.
No problem. Thank you.
We had 2 students in our next brief interview, Finley Kruger and Angelica Sedano, who, with Roscoe and Hedquist from the New England Center for Children, put together their poster on the treatment of stereotypy, differential reinforcement schedules, and reinforcer delivery rates.
So I'm here talking with Finley and Angelica about their research on reinforcer delivery in DRA versus DRO schedules. So could you guys tell me a little about what you did for your research here?
Yeah, so we compared DRO to DRA. We also compared DRA to baseline, and we also compared DRO to baseline to find the independent effects of them. What we found that DRA was more effective than DRO to decrease stereotypy and to increase engagement. We also found that DRA was associated with higher reinforcer delivery rate than DRO.
Okay. like you were expecting those results, or you just didn't know what you were going to find when you started this?
Well, we didn't know, but these were the results for 2 of our participants. For one of our other participants, it was similar against both schedules. So that was interesting.
Okay.
Yes.
Now, what was it? Did you know the function of the stereotypy for the student? Was it automatically maintained? Was there? All right. I'm surprised you got competing with the DRO, and well, the DRO did anything. You know, it's those typically I found those to be very hit or miss with students.
Yep.
Yeah.
DRA definitely had the better effects here.
That's good.
Yes.
Did you hit any bumps in the road when you were either like implementing? 'Cause I see you have many graphs there, very, very busy.
Yes, definitely. We had a lot of sessions because we were targeting different things. So we had the motor stereotypy, the engagement, their productivity, and the reinforcer delivery rate.
Okay. Wow. And you did this for over 125 sessions. Look at me. Wow.
Yes.
So how were you recording all this? You just long hours scoring tape afterwards?
Yep. These are all video recorded. So what we did was go back for the reinforcer delivery rate, rescored all the videos for reinforcer delivery rate.
Oh my God.
Yes.
How long did that take?
Well, we were on a pretty tight schedule, so we got it done in about 2 weeks, but there's a lot of time into it.
Oh my goodness.
Yes.
So is this something that you are going to be doing more work on, you think? Or anything you found from this that you're going to use in your own practice?
Well, we did find that future research should probably look at like DRA and DRO schedules, but yoking the schedules to compare them, because that was something we found and we thought that might be interesting to do for future research.
Excellent.
Yes.
Well, thank you both very much for your time. I really appreciate it.
Thank you.
Our next 2 interviews featured students who had a second author on their posters that listeners to the show might know, one Jackie McDonald. And those posters were first Caitlin Miles' poster on teaching children to implement response interruption redirection to reduce sibling stereotypy. And after that will come Tayler John's poster, teaching abduction prevention skills to children. Both of these students, of course, work at fabulous Regis College.
All right. So I'm talking to Caitlin Miles about her very interesting work on teaching children to implement RIRD on their siblings.
Yeah.
That sounds kind of mean in a little bit of a way. Siblings already don't get along very well.
Yes, it was done in a very play-based way, though.
Okay.
So we did it in playrooms. We used picture books that were very familiar, and the children loved them. So while it may seem a little harsh, I think we did it in a way that definitely still kept the sibling relationship intact and in good standing.
I mean, they're going to fight anyway, whether you do treatment or not, probably.
Yeah. Maybe.
So what was kind of the overall the procedure that you used?
Yeah, so we did a multiple baseline design. We taught them to implement this procedure, the sibling implementers to implement this procedure using BST. And to ensure that our children with autism were able to have a reliable tact repertoire, since that was such an integrative part of our study, we did a tact assessment. So once that was done and the BST was done between myself and the sibling implementer, and we used a little bit of a different spin on BST. So we did a video model, and then we also had the role play was done in such a way that they had to listen back to that video that I had taken in baseline of the sibling with autism, so they could hear the stereotypy responses that they would actually be needing to interrupt.
Okay.
So that was a little bit different. And after that, we did our IRID sessions, and as you can tell, it did actually work, which was awesome. And we also did take data on appropriate vocalization, so that we were having a measure that we were trying to increase while decreasing the stereotypy.
Okay, great,
Yeah.
very good. And did the sibling implementing RIRD have anything to say about the experience? Like, I liked doing it. I liked being helpful.
So the first time, or the first few times that it actually worked, they were effectively able to stop the stereotypy. So you can see it took a little bit, but
Yep.
so they were saying statements to me like, "He did it! I did it! It worked!" And I was like, "Yeah, you did! Great job!" So there was definitely some shock statements, and then at the end, we ran social validity with parents just because of the age of our siblings.
Sure.
They probably wouldn't be able to do it, but both of the sibling implementers did talk to me about it after, and they were like, "Oh, that was great! That was fun!"
Okay.
So I took way positive things from it.
Yeah. Now, is this something you feel like, are you doing any more work on related to stereotypy or sibling interaction, or this was sort of just a kind of one and done?
So it's definitely something I'm interested in the future. I haven't done anything since graduation.
Oh, okay.
But it's definitely an avenue I want to explore more and try to get some other people to maybe explore it with me.
I like that. I feel like usually with the home component for stereotypy, it's a lot of, hopefully they know like this is where you can do stereotypy, but you can't do it here. This is the time for stereotypy, the time you can't. This seems like a nice idea of like, you could actually set up more positive opportunities. It's not just you're in your rooms of stereotypy, but you can in the kitchen. It's a good alternative to that.
Thank you.
Yes. Oh well, thank you very much, Caitlin, for talking with us. Really appreciate it.
Thank you for stopping by.
Of course. All right, so I'm talking with Tayler Johns about her research on teaching abduction prevention skills to children. So this is a very important topic, and I know that there's been some research about it. So what was kind of your take on the process?
My take was on the process is I wanted to see if BST could be taught one-on-one with a child. So I had to be both in the modeling stage of BST. I had to be both the abductor and the child to model it. So it was a very interesting process, let's put it that way. So I had to wear a hat if I was the abductor, and I would take off the hat if I was the child, and that's how I taught abduction prevention skills. And then we kind of did replicate, you did BST and then you tested in the natural setting, and if they did not perform at an optimal score, you would implement IST.
Okay.
Yeah.
And so what were the results?
Yeah, so the results were that 2 of our triplets performed at optimal levels right out of BST.
Your subjects were triplets?
Yes.
Oh, okay.
Yeah, so now we've got a little bit more interest there.
Okay.
Yeah, so I had triplets. So 2 of them did perform at optimal levels right out of BST for all 4 abduction probes, and then they got to move to follow-up. One of the triplets did not perform at optimal levels, so we did step in and do some IST. The next probe, he did perform at optimal levels, scored 4, optimal levels for the next 4.
Yeah.
They got to move to follow-up. The triplets did generalize their behaviors across time and across settings.
Oh, great.
Yeah, so IST was done in front of their home, and follow-up was done at a playground.
Oh, okay, great.
Yeah.
So what did it, when you had to give the feedback for the in-situ training, what did that look like? Did you do this sort of like, hold on, no one's really trying to steal you, but you were supposed to...
Yes, I appeared out of like a tree, so it was very weird. And I was like, oh, hold on. And I was like, remember, when someone comes up to you and says, come with me, or I want you to come help me with my dog, you have to say no, leave the area, and tell an adult. Those were our 3 responses.
Okay.
And so what I did is had him, the parent stood on one side of the yard, me and the Confederate stood on the other side, and we would practice it 4 times at optimal levels with me standing there. So the Confederate would say the lure, and the child would have to perform each one, and I'd walk it through with him and praise him every time after he performed them all correct, optimally.
And for all this research, nobody tried to call the cops on you or anything at all? Okay, good.
We did have a neighbor come out, and he was a concerned neighbor, and I explained to him, and then after one of our first ones, because the triplets, so we did them all 3 at the same time, not same probe, but same time period, I had the parent come and talk to the neighbor, because I was like, I fended him off for 1, but you guys need to go talk to him.
Yeah. Well, that's always kind of, I think, the worst part of doing doing anything out in the community is the sense of, does this looks so
it
weird.
It looks so bad. And coming up with the abduction lures, you just feel really creepy. And
it's good that society is going to call the cops on you.
And I'm hiding in a bush, and like someone else is like trying to pretendly abduct a child. Yeah, it's just really not a good situation.
Oh boy. So are you going to be continuing any kind of work on this line of research, or more you just wanted to sort of see what it looked like for the clients you were working with?
Yeah, so I wanted to do it for that. I'm hoping to maybe get it published in the future, so that would be really great. And I have had a few approaches to kind of do it with other clients and do it with other individuals that I work with.
Anything that you think you'd change about the procedure, or it pretty much went the way you wanted it to go?
As far as triplets go, separating them a little bit more probably was a little bit of a confounding variable. I think they need to be separated a lot better. Make sure that they don't see each other or they don't talk to each other after one of the probes were completed. So, but I don't think I'm really going to get that many more triplets. So I think
you might get some siblings.
Yeah, I think I'll be in the clear for the most part. I can separate 2. It's when there's 3 that it gets a little bit more messy.
It's a little weird.
Yeah.
All right. Well, Tayler, thank you so much for taking the time to talk.
Thanks. I love talking with you.
Thank you.
And finally, we spoke with Kara McLean, who, with Turan from the New England Center for Children, did a poster on the assessment and treatment of trichotillomania. Are competing items effective when treating multiply controlled behavior?
So I'm talking with Kara McLean about her research on trichotillomania. So Kara, tell us what you did with your research here.
So we had a participant who was a 14-year-old vocal verbal female with autism, and we did a functional analysis for her behavior, which was trichotillomania, in other words, hair pulling. So she was doing a lot of this across her day, so we wanted to, and it was really interfering with her day and her ability to focus, her ability to not have her head be bald. So we assessed it. It was multiply controlled, so it was controlled by automatic reinforcement and also access to escape from demands. So we did a competing items assessment to see how that would work in the context of just alone. So then out of those, the ones with the least amount of engagement, or the highest amount of engagement, and the least amount of hair pulling or trichotillomania were chosen. So that was a hat and putty. And we found that the putty was the item that competed the most with her hair pulling. So we had really low, almost near zero rates of hair pulling and really high rates of compliance with demands.
Okay, excellent.
Yeah.
This reminds me, I'm going to take you to the Wayback Machine. My very first year in the field, I saw someone doing similar research related, not research, but similar kind of competing items assessments with trichotillomania.
Yes.
So it's great to see that there's still people kind of thinking and extending that kind of those original studies on it.
Yeah,
so,
absolutely.
Excellent. So what was kind of the big, did you have like a big take home or anything you think about for practice that your research has kind of given you a new appreciation of the research process or trichotillomania treatment?
Yeah, so I think the biggest takeaway is that it's important to assess competing items and to not just select one randomly for the student, because we did see that only one of the items was successful in reducing her problem behavior. And it's also important to assess it across context or for generality, so whether the student's alone or in another context such as demands. So that way we know for sure that this works, the putty works with her when she's alone and when she's in a situation with demands.
Excellent. Well, Kara, thank you so much for your time.
Yeah,
really
thank you very much.
It's always such a treat to see the research coming out from new students who will very soon be fellow behavior analysts in our field. When all is said and done, one of the favorite things I think Diana and I and Jackie as well will remember about the BABAT conference, especially at its UMass Amherst location, is what went on after the conference was over. We'd often go down to what used to be a tiny dive bar. It has moved into a much fancier digs, the Hangar, which I linked to in the show notes if you want to check it out. They have fabulous wings, and so we'll usually go together with some of our former colleagues, current colleagues, and sort of talk a little bit about our goings on. And I made everyone spend a few minutes using our cool new digital recorder, talking to me about some of their favorite memories from the 2018 conference and from BABATs of the past. So indulge us for a moment, if you will, as we share that wonderfully off-the-cuff recording.
Only invite me on the show where we do your treatment stuff.
Yeah,
the only show I'm invited to.
Everyone, I'm not the only one you're invited to. That was the one I thought would be the most appropriate.
For me.
I was like, who else would want to complain about stuff for like a full hour? I was like, Pauline! Oh, the beers are here. Right.
Just in time.
Just in time. Delicious pumpkin beer.
I've got the old pumpkin beer glow.
I am going to go grab this.
Thanks.
Awesome.
Could have
All right, so we are here. I'm here with Diana. We're here at the Hangar Pub and Grill after BABAT. It was a fun day. I'm here with we have some other folks here.
It's Hangar like an airplane.
The Hangar like an airplane, getting wings. We have state your name.
Colleen Callahan, BCBA extraordinaire.
Carolyn Beaumier, Wachusett Regional School District, BCBA, and preschool teacher.
All right.
Dean Jacobus, not a BCBA, CPA and a realtor.
Rachel Friedman, super fabulous BCBA at Regis College Autism Center.
Why are there Regis College people here? It's ridiculous. Well, so we're here.
Getting around.
We just had a great time at our first day of BABAT, and unfortunately, we're at our favorite post-first day of BABAT hangout. But BABAT is moving to Worcester, which is good for BABAT, not so good for us.
Mixed feelings.
I know, mixed feelings. Mixed feelings will be had.
Sadness.
I know. Carolyn, what's your favorite BABAT out in Amherst memory?
Okay, well, I love when we go to a symposium on the top floor, which is what you and I did today, because you can get this wonderful information while having this beautiful view, and I absolutely love it. It makes me so happy, and I was thinking of that today. That was for the last time.
Yes, and the view was crummy today.
Yeah, I wasn't going to dwell on that, but yeah. The foliage.
Yeah. The foliage.
Foliage.
How about Colleen? What's your favorite BABAT memory? 'Cause you're a more recent BCBA, so you haven't had as many great drives out here.
There's really great camaraderie at Amherst. There is.
True.
I'm gonna miss the Hangar Pub. I'm gonna miss the long drives with Carolyn.
Yeah, for sure.
And I'll miss, I don't know, being away from my kids for a night because I have an excuse not to drive home.
Yes.
You know what my MO is.
I know. So Rachel, what did you see today that was exceptionally fun? That you would interrupt eating these delicious tater tots for?
It actually wasn't at BABAT. Can I still share it?
Of course.
Okay, so this
I don't know if I'll
morning,
use any of this audio. So.
this morning, as part of my PhD program training, I went to Boston Children's Hospital, and I got...
We're joined by another BCBA. We're just recording. It's our last time here. You can move those out of your way. Do you want to introduce yourself?
I'm Katie Trust.
We're just sharing some memories.
So I went to Boston Children's Hospital this morning, and I got to shadow a developmental pediatrician working with toddlers with Down syndrome and their families, and I got to play with the cutest kids ever, and it was fantastic.
That doesn't sound like schoolwork, Rachel. Are you sure?
It was, because I'm learning what the developmental pediatrician does and all the referrals that she makes for different types of challenges.
Okay. Very nice.
Yeah.
Katie, what's your favorite memory of BABAT? We're all sort of opining the fact that we will no longer be out here in beautiful Amherst.
My favorite memory of BABAT is probably some of the random room assignments but like the room situations that you end up in where you're like, I'm just gonna go. I don't really know where I'm staying tonight. Let me, get out there and sort of see who I can crash with. And then you end up in like really random situations. So that's probably got to be one of my favorite BABAT.
Good times.
Things that when we're at the DCU Center, we're not going to do anymore.
How are they going to do that at the DCU Center? I feel like it's a
Everyone's gonna be at
concert or something.
Right? I said that Colleen could open her house out as an Airbnb because she lives like 10 minutes away.
Mm-hmm. And we thought we could offer it to Pat Fryman.
I wonder if we could.
Yeah, and stay at my Airbnb.
Pat Fryman's talk today. What were your thoughts?
I think that he is like a behavioral rock star and can just do whatever he wants now.
I thought today was I felt kind of sad. Like it was very contemplative in a way that I was feeling a little.
I liked it. No, I had liked it.
Yep.
I enjoyed it. I always enjoy his talks, but it was like a BCBA coming to the end of his career, his illustrious career.
I did think to myself that between that and the ethics address, it was an incredible. They were both incredibly personal. which
I think it reflects the end of BABAT at Amherst. It's mirroring the feelings that everyone's having of BABAT at Amherst ending.
One time I was at the same bar as Pat Fryman at ABBA. This was in San Diego in May. And he was sitting right next to me, and I introduced myself, and he was like, "Oh, Friedman and Fryman, our last names are kind of the same. I love that." And then I was so starstruck that I was talking to Pat Fryman that I couldn't think of anything else to say. And then he just got up and walked to the other side of the bar, and I was just like, "I'm out."
I remember there was a year where there was a T-shirt with his face on it that was like a prize at a raffle. I forget. It was like a BABAT social, I think, maybe. Yeah.
I remember that.
That's awesome.
Sorry, Diana, what was your favorite? Either your favorite memory or the favorite thing you saw today?
Today?
Or ever.
Or ever? I thought you were going to ask who my favorite memory.
What's your favorite memory?
I'm redoing what I'm thinking about.
Okay.
I think one of my favorite memories is the time that Jackie got laryngitis.
Oh, yeah.
And I had to give her talk.
What was the talk about?
Maybe behavioral momentum. It was a long time ago.
Everybody's favorite topic.
So that was a really good memory. I also gave my first ever conference presentation here, and it was when I was pregnant, and I was so nervous, and it made the baby flip out, and he was like turning in like somersaults the whole time. Yeah, because it was like so much.
Wait, which baby?
The first one.
Oh.
Yeah.
That's always.
Yeah. And then, my other favorite memories were probably coming to the hangar and some other after parties.
Oh, yeah. I remember when this place used to be like a dive bar. Now it's like a...
I was here for that one.
Did you make
I was actually here for that.
Was that your first?
That was my first one.
Oh, man.
But you know what really made me happy tonight at BABAT? Going to the poster session and seeing one of our very first Regis College graduate assistants from our Autism Center present her poster. Tayler Johns did a really cool poster on
I interviewed her.
teaching abduction prevention skills to typically developing children, and she has great data, and it's amazing, and I'm so proud of her.
Ah, good. Well, I think that's good. Anyone else have anything they want to share about their BABAT? Oh, Katie, I asked you. I forget which question. I switched my questions midstream.
Yeah, you're good at that. Staying on task.
I just got my beer, and I already can't keep my
already a
questions
sip of
together.
beer and you're
It's
done. Going back to Fryman, your question about Fryman earlier, I don't know if it's just sort of the age we're at, where like everyone we know has small children, but the whole like focus on the parenting thing like really hit home for me today. Like I was near tears a couple times during his talks, and I was like, middle of a conference, don't cry, I'm an adult. So that was really key. And I'm trying to remember, I was thinking about this tonight actually. Who did the last talk last year? The Friday afternoon, like nobody stays for. Was it Fryman last year who did the like
I think they did,
10 points of like the 10 pragmatic applications of behavior analysis?
I think so.
Like that one really stuck with me. It's, I don't know, I love getting to see Fryman speak. Like,
yeah, me too.
It's one of my favorites.
It always brings it back around to what's important. Yeah.
Carolyn and I were talking on the way here about how we hope that BABAT will still do something at Amherst, like a social or something.
Like maybe
to keep the connection alive.
Maybe if they did, I feel like if the BABAT social would be hard because it's just for the night, but if they did like a retreat or something of workshops, that might be cool.
Even like a 1 or 2 day little mini conference on just ethics or supervision or something like that.
I don't feel like I'm ever going to come out here again, but the fact that it's the Berkshire Association, it would be nice.
Yeah, I agree.
Yes.
Good
Very
point.
true.
Hint, hint, BABAT.
Ah, well, so many good memories, so much fun. All right, well, I think that's enough of this. Let's all enjoy some delicious wings here.
All right.
Cheers. BABAT signing off.
Well, we hope you've enjoyed this year's BABAT special episode. Thank you so much to the BABAT committee, all the fine folks who helped organize this great conference. It is definitely one of our very favorites. Thank you so much to everyone out there listening to the show. Remember, you can find us online pretty much everywhere as ABA Inside Track. Please subscribe and send us emails and like us on Facebook, Twitter, Instagram, all those great places. And of course, emails at abainsidetrack@gmail.com. We'll be back next year with another one of these, and probably next week with another one of our fun episodes on behavior analytic topics. But until next time, keep reaching for the stars!